Hi, I'm Tom Cantrell. Welcome to Live Pain Free, a video podcast about non-surgical options to treat common arthritis pain. I have a special guest with me today from NYC Pain MD, the go-to clinic in the tri-state area for non-surgical pain relief, when I come back. I have as my guest by telephone today the Chief of Patient Education and Patient Care Coordinator for NYC Pain MD, and he can fill us in on just what options you have to live pain-free when it comes to arthritis in general, and specifically knee pain. Hi, Alex. Thank you for joining us today. I'd like to start with a few basic questions about how your doctors are helping so many people with arthritis without surgery, without the medical risks and high costs. Can you give us a quick overview?
Well, sure, Tom. I'd be happy to do that. Thanks for letting us do this webinar today. I'm sort of stepping in for the doctors. Of course, they've been so busy. But any information, by the way, Tom, is not a recommendation. This is just for general discussion. And we can talk later about how patients can ask specific questions and find out more. But all that being said, Tom, I am the Chief of Patient Education as well as the Patient Care Coordinator in the facility. And the mantra of the office, the philosophy, is that the doctor's goal is always to get, or the doctors, I should say, is to get patients moving better, feeling better, keep them off the heavy medication, keep them more active, and hopefully allow them to completely avoid surgery down the road. Now, there's many different techniques that can be available. Every case is different from the next. But typically their specialty is sometimes considered interventional orthopedics or offering specialty procedures that are for orthopedic conditions, arthritic knees, hips, shoulders, etc. But the one important thing, Tom, is that just like flying an airplane through the fog, procedures must be ultra precise. So our physicians always use special imaging to very precisely guide procedures to, number one, make it more comfortable, number two, make it safer, so any further damage is not done, and maybe the most important, to make sure that any medicines or lubricants or procedures or pain-blocking mechanisms are very precise, and this is precision arthritis targeted treatment. So that's the general overview of how our doctors look at patients.
Alex, can you tell us about a few of the special techniques or treatments offered at NYC Pain MD?
So, Tom, that's a great question. There's so many patients interested in this and so many patients that have the type of conditions we treat. One of the most, the highest number of calls and inquiries we get is about arthritis, knees, hips, shoulders. So before I answer that question, I'm going to give you a very quick review of what arthritis is. In every joint, there are cells that line that joint that produce special lubricants, and it's called synovial fluid. Think about synovial fluid, Tom, being very much like oil is to an automobile. And if you have either not enough oil or no oil in the car, you create a lot of friction between the parts. So essentially, sometimes from wear and tear, damage, injury, stress, aging, you're not producing enough lubricant in the joint, and it essentially dries out. So one of the most popular procedures, it's a fancy term called viscosupplementation, but again, under guided, precise, instrumented imaging, targeted therapy, special FDA-approved lubricants can be applied very comfortably to the joint space. And the doctors will actually watch that lubricant be delivered. There's lots of things done either individually or in combination to get patients to the goal that they want, which is more active, pain relief, moving better, getting out of surgery.
I'd like to thank Alex for being with us today. And I'm sure you and I both know a lot more than we did about non-surgical treatment of knee pain. Before I go, I'd like to remind you that NYC Pain MD offers a risk-free, no-obligation evaluation in their office to determine if this type of treatment is right for you. If it is, treatments are covered by many insurances, even Medicare. Call 800-298-8610 to set up your risk-free evaluation. That's 800-298-8610. For Live Pain Free, I'm Tom Cantrell.